So finding out more about Alzheimer's risk is going to be really important as we have better tests to predict a risk for memory loss at some point. And so some of those tests are testing for the common risk gene, the APOE4 gene. That can be done with a blood test or a cheek swab. People can do it on their own through direct-to-consumer testing. We recommend they do it in a clinical setting so they can get support and education about their results. And we've been studying that, one in the generation trial, which was for E4 carriers. And we did wide genetic testing for that, for APOE. And in our own program, we've been studying the psychological impact of finding out your APOE status. And so far, it seems very well tolerated, at least from people who want to know. It's been important information to them, and they've been able to receive it safely. So it's very important for clinicians, as we have more tests that can predict risk, to have a discussion with individuals and patients about, is it wise for them, a good time for them to find out this information, and how might they handle it? And if so, then help them with that process, help them understand the information. I think it can be done, and it's going to be a very important dimension of Alzheimer's care as we go earlier in the disease course. So we got to get good at it. Falls into three groups. There's one group that really wants to be proactive, wants to find out. They've usually experienced Alzheimer's in their family. They know what it is. They don't want to have it. They want to do whatever they can to lower their risk. And now we have treatments that actually lower risk, potentially. And then there's a group that are really nervous and they can't even think about finding out. And then there's a good-sized group in the middle who see the advantages, but also are nervous about it, so they're not sure. I think the more conversations we have like this, the more that group will shift toward one, and the more treatments we have available. I mean, if you can do something, just finding out is one thing, because that, especially if you're older, that can help you plan for the future. But if you have a treatment that could lower your risk, then finding out, it's important to find out. And we find out about high blood pressure and cholesterol and cancer and all kinds of things because we want to do something about it. Same thing for Alzheimer's.